of time. I want to thank our Vice President for the task force and the work. Every day it gets better, and we had a fantastic call with the governors today. And I would say that they are as thrilled as they can be, considering that the fact is that there has been so much unnecessary death in this country. It could have been stopped, and it could have been stopped short, but somebody a long time ago, it seems, decided not to do it that way, and the whole world is suffering because of it, 184 countries at least. But I want to thank all of these great business men and women for the job they've done. They've been fantastic with us, working with us. And as you know, for several weeks, my administration has encouraged the governors to leverage unused testing capacity in states. Very few understood that we have tremendous capacity. Then 1 week ago, we provided each governor with a list of names, addresses, and phone numbers of the labs where they could find additional testing capacity in their states. Within 48 hours, the number of tests performed across the country began to absolutely skyrocket. On Saturday alone, more than 200,000 test results were reported, which is a gigantic number, bigger than any country anywhere in the world for a much longer period of time. A number that is an increase earlier in the month when we tested roughly less than 100,000 a day. So we much more than doubled it, and that will be doubling again very shortly. We are continuing to rapidly expand our capacity and confident that we have enough testing to begin reopening and the reopening process. We want to get our country open, and the testing is not going to be a problem at all. In fact, it's going to be one of the great assets that we have. Today, we're releasing additional guidance on testing to inform the states as they develop their plans for a phased and very safe reopening. Our blueprint describes how states should unlock their full capacity, expand the number of testing platforms, establish monitoring systems to detect local outbreaks, and conduct contact tracing. We have it all. Other countries are calling to find out what are we doing and how do you do it, and we're helping them. We're dealing with a lot of countries, helping them on testing, just like we did on the ventilators. I directed our Medicare program to make it easier for seniors to get the testing that they need, and the pharmacies, as you know, we are allowing pharmacies now to do testing, and we have other testing locations that we're going to be allowing also, but having pharmacies get involved in testing is a very big deal. We're also asking governors to do the same in their Medicaid program, so they're going to be able and authorized to do the same in Medicaid. So that's a big deal. So we're deploying the full power and strength of the federal government to help states, cities, to help local government get this horrible plague over with, and over with fast. There's tremendous energy in our country right now. There's energy like people haven't seen in a long time, a spirit that they have not seen, and we're doing very well, considering what happened to us, and considering if you look at what happened to others. This is something that the world has not seen for a long, long time. You can probably go back to 1917, where it was a terrible period of time. You all know what happened in 1917. That's over 100 years ago. With that, I'd like to introduce, if I might, Dr. Birx, if you could come up, and then Admiral, you'll come up, and between the two of you, you'll explain the entire process and how much progress we've made and where we're going. Thank you very much. Thank you.
Thank you, Mr. President. So the blueprint lays out the roles and responsibilities to enhance our partnership between the private sector and the public sector, bringing together state and local governments with the federal government to ensure that we can accomplish and achieve our core principles and objectives. We can have the first slide. The core elements of the testing plan include both three elements: robust diagnostic testing plans developed in partnerships with state, and I just really want to thank the governors and the health officials, both at the state and local levels, who've been working with us day and night to work through these issues, and also all the laboratory directors in many of the states, as well as the American Society for Microbiology, who've been working with us to ensure that the plans were efficient and effective. Within the robust diagnostic testing plans, it was really unlocking the full capacity of the state, increasing the number of testing platforms. We now have multiple tests for different platforms, increasing the ability to collect samples, increasing testing and laboratory supplies, and ensuring that we work together to make sure that every client receives the tests that they need. This is added with timely monitoring systems. And what do I mean by that? Systems where we bring together the ability to not only diagnose the symptomatic, but proactively and interactively work with individuals that we know are at higher risk. We've worked with states to look at where the outbreaks have occurred when they're not in the large metros, and we see that it occurs very often in places of closed settings among our Native Americans and among our long-term care facilities. So an active monitoring program that's active, integrated, and innovative. And then combining us with the third element, which is the rapid response program, relying on CDC to be working with state and local governments to ensure that every symptomatic case, and critically the asymptomatic cases, are quickly tracked and traced to ensure that we can not only control this epidemic but predict outbreaks before they expand. And then finally, the plan includes an approach of using science and technology to develop even newer platforms, more efficient testing, really ensuring that the antibody tests that are utilized and recommended by both FDA and CDC have high quality in predicting both exposure to the virus and antibody development. And then finally, working on innovative tests that could be high throughput and point of care, an antigen-based test, or a point of care expanded nucleic acid test. Thank you.
Thank you, Mr. President, and thank you, Ambassador Birx. If I could have the next slide, please. I want to spend just a couple of minutes about going over where we've been, but more importantly, where we're going. I think we all can understand how we can group this into three distinct phases. First is our launch phase, when we were really engaging the emerging epidemic and the types of things we need to do. For example, mobilize the private sector to develop, test, and have EUAs. And I think you know over the past 2 months, the FDA has issued 67 emergency use authorizations, which is far outpacing anything that has been done or could ever been imagined. Galvanizing the research community in the commercial labs. The reason why we're here with ACLA Labs having done about 3 million tests is because of that day when it was galvanized by the President and the Vice President. We also set models in the community, those first community-based testing sites that were federally supported and really under the direction of the U.S. Public Health Service, people who had been in Japan testing people on the Diamond Princess to assure that it would be done right and it would be done safely for everyone involved. Then we moved to really scaling. That phase was very, very important because we knew we needed to be at an immense scale to enter the third phase about supporting opening again. This again, for example, a lot of my life is about swabs. It was enhancing the production capability of a small company in Maine called Puritan that you'll hear a whole lot more about, that is sort of the swab provider for the country, but also because of the FDA actions and the actions of scientific community being able to broaden the types to spun polyester. So U.S. Cotton can now come in and start delivering within the next couple of weeks 3 million swabs per week of a different type. It also did things like expanding the community-based testing sites. Whereas we started small with the commercial partners, you see today, right now, we have 73 of this 2.0 sites going to 110. And very importantly, this demonstrated the model. And 68% of those sites are in communities of moderate or high social vulnerability, and 22% are in the highest social vulnerability communities, so that we can make sure the testing gets where it needs to be. You've just heard that that could be expanded to thousands of sites. And finally, stage 3, which is very exciting, coordinating with governors to support testing plans and rapid response programs. Over the past week, a multidisciplinary team from the White House, HHS, FDA, FEMA, has met virtually with multidisciplinary teams from every state, Puerto Rico and the District of Columbia, to understand what their testing aspirations are and to make sure that we can meet those demands. We're going to have another round of those calls this week, but as we talked about earlier today, we will be able to supply every state with the supplies and the tests that they need that will dramatically increase the number of tests we've done to this point. And just to give you an idea, the supplies that we will be providing to states, the minimum that we're supplying to states is approximately double in that month than the Republic of Korea has performed in the 4 months to now accumulated, to give you an idea of the amount of testing that we're going to be doing. So I'm very excited right now as we complete this ecosystem with the large reference labs, the LabCorp and Quest providing the very high throughput, large-scale testing, the galvanizing of the hospitals and academic labs that Dr. Birx has done by a machine-to-machine understanding and promoting that with the governors, and of course using point-of-care testing when and where that's very important to stop outbreaks or in remote areas like in the Indian Health Service or in Alaska. Thank you, Mr. President.
Thank you very much.